Today, Mayor Marty Walsh and Boston Medical Center announced a new program aimed at connecting low-income residents to the city's bike share system to help address health disparities in the city. It's been dubbed Prescribe a Bike, and it's part of a growing trend of doctors urging patients to make lifestyle changes to stay healthy. I'm joined now by Portland Helmick, who is an expert in alternative medicine. Welcome to Greater Boston.
Thank you so much for having me. I appreciate it.
There's a movement to have nutritious meals covered by insurance for the very ill, just like medication. Is that realistic, do you think?
I think it's absolutely realistic. I mean, healthcare costs in this country are out of control. We spend $3 trillion a year annually on healthcare costs, and people are now beginning to understand with the advent of healthcare reform that it makes sense because food is such a low-cost intervention. And if we can get people access to healthy, nutritious food, they're more likely to go to the hospital less frequently. They're less likely to have long hospital stays. They're less likely to be readmitted to the hospital.
There's an organization that's active in this movement. In fact, they may be a prime mover in it, called Community Servings. I understand you're familiar with that. What are they all about, and how much impact will they have?
They're an interesting organization. They were founded in 1990 to serve people with HIV, and at the time they were serving about 30 meals a day. Now, here we are 20 years later, they're serving 875 meals a day, and these are to chronically and critically ill people in about 18 communities in eastern Massachusetts and Worcester. And what they do is this is run by charitable donations for the most part, and they have about 75 volunteers, and they deliver these meals to people's homes once a week, lunch, dinner, and a snack, and they deliver it not only to the ill person, but to the children as well, and the spouse or the caregiver, because they recognize that when people are ill, they're low income, they're probably going to give a meal to their children, so they make sure to feed the entire family.
How much does it cost? I'm sure that's a question that many of the viewers have on their minds.
Right, right.
For instance, what does it cost for Community Servings to do this?
What does it cost for Community Servings? Right, for the individuals, it's not costing anything, right? But for Community Servings, as I said, it's run by charitable donations, but it costs about $20 a day, and that includes the delivery for one person. But if you compare that to about $2,500 a day, which is the cost of a hospital stay in Massachusetts, it's actually quite a bit less expensive.
What's keeping physicians from prescribing certain foods for their patients depending on their condition? What's
keeping them from prescribing certain foods?
Instead of drugs?
Well, I mean, to be perfectly honest, if you want me to tell you the truth, I think most physicians don't know that much about nutrition. They study very, very little nutrition in medical school. So if you really want to know what to eat, you probably need to go to someone other than a traditional doctor.
How do you think this would work if medically tailored meals were covered by health care insurance?
Well, think about how it works now. If someone has a cardiac event, they're discharged from the hospital, and someone, when about 5 minutes before they leave, says, oh, by the way, you need to completely change your diet. You can't eat this, you can't eat that, you need to change the way you cook. And if you're someone who's low income, and maybe you don't speak English that well, this is completely daunting and overwhelming. But what if, when you left the hospital, someone said to you, you know what, you need to change your diet, but what we're going to do next week is we're going to start sending medically tailored, nutritious meals to your home. Then there would probably be much more compliance. But what would it look like? Doctors would write prescriptions. Hospitals have community benefits programs. They have to give a certain portion of their profits to community benefits projects. So Community Servings, this organization we were just talking about, they're hoping that they can get incorporated into these community benefits programs.
We're running tight on time, but one more question, if I may. How much research supports this idea or this concept?
Yeah, that's important. There aren't a lot of large-scale studies, but there are smaller-scale studies that have been done, and there's a recent study out of Brown University, and it estimated that if all states had increased by 1% the number of adults 65 or older who received medically tailored home-delivered meals in 2009, annual savings to states' Medicaid programs could have exceeded $109 million.
Well, Portland Helmick, thanks for joining us.
Thank you.